Good afternoon, everyone, and welcome to the Greensboro Chamber of Commerce's second vaccine action call. I'm Deborah Hooper, COO for the Chamber, and we have a great turnout again today for this call, and that's really no surprise to us, considering how many businesses we're hearing from who want and need updated information about the vaccines and the vaccination process, as well as the legal do's and don'ts that employers need to think about with regard to the vaccine and perhaps return to the office instead of working remotely. If you've joined us before on our action calls, welcome back. When new information needs to be shared on critical topics impacting our business community because of the pandemic, we set up these action calls to continue to provide that information and resources from the experts to our business community. There is going to be a recording of this call made available on the Chamber's YouTube channel for everyone who wants to go back and listen again. And for those who couldn't be with us at 2 o'clock today, they can watch it at a time that's convenient for their schedules. We're going to hear from 3 expert panelists first, and then we're going to facilitate getting any remaining questions that you may have answered. And first, I'd like to introduce our panel. Hattie Gawande is the Senior Policy and Intergovernmental Affairs Advisor for the North Carolina Department of Health and Human Services. Dr. Iulia Vann, Director for Guilford County Public Health. And Shawn Straub is the founder of Alt HR Partners. Welcome to our panelists. And at this time, I'm also going to introduce my colleague, Meredith Berger, who is Director of Existing Industry for the Greensboro Chamber. And Meredith is going to take it from here. So Meredith, here you go.
All right. Thank you, Deborah. And hello to all of you out there in Zoom land. Thank you so much. I see lots of familiar names and a few faces, but thank you for joining us today. I'm glad to have you. As we promised on our call back in February, for those of you who were with us, that we would certainly not make that the last call on this subject. We knew that more information was to come, and we knew we wanted to make sure we got that information out to you from the experts. It's best to hear from those who know or in the know for sure. So again, thank you for being here. We are going to ask you to please be thinking of questions for Hattie, Dr. Vann, and for Shawn. We'd love to hear those questions. If you want to put them in chat as we go along, or wait till the end is fine too, but know that we will address those as many as possible on the call. And we also ask that you, in addition to questions about this subject, please let us know as questions come up in your workplace, as you're progressing through these times. We'd love to know what those are so that we can work with you and understand what you're dealing with in your facilities, in your small businesses, and your large facilities, and continue to help you through this process. So again, thanks for joining us today. I'd like to start off by introducing again Hattie Gawande, who has become a good friend of ours and is one of our industry experts in from the Department of Health and Human Services, as she shares some updated information with you. Hattie.
Great. Thank you so much, Meredith and Deborah. And thanks for having me. I'm also, of course, Dr. Vann is going to be helping me with this initial part. We're going to first do a little bit of level setting on information about the vaccines. I think the last time that we spoke, Johnson & Johnson hadn't even been fully approved by the FDA yet. So definitely a lot has happened from then to now. And there were some specific questions that came into Deborah and Meredith that we thought we would just knock those out right off the top. And then after that, I will go right into some updates from the department. So let me share this deck real quick. And there we go. Should be in presenter mode. Okay. So these are, we put, Dr. Vann put together a few slides, just 5 or 6 slides to address specific questions that came in. I'll just quickly run down what we know right now about the 3 vaccines that have been approved, which are Moderna, Pfizer, and Johnson & Johnson. As you've probably been hearing, all 3 vaccines are incredibly effective. They all in all 3 of their clinical trials, completely eliminated hospitalization and death from COVID-19. And so that's why we think that they are all sort of equally valuable. They all achieve the common aim that we have of preventing death from COVID-19. Our secretary, for example, got the Johnson & Johnson vaccine. To date, the clinical trials for Moderna and Pfizer were shown to be about 95% effective, whereas the Johnson & Johnson vaccine trials, which notably, some of those trials happened in the presence of variants, whereas the Moderna and Pfizer vaccines did not, were closer to 66.3% effective in preventing that moderate to serious illness, but still 100% effective in preventing hospitalization and death. And the key thing here is that people are fully protected, considered fully vaccinated 2 weeks after you get your second shot, or if it's Johnson & Johnson, 2 weeks after you get that single shot. So we've had some cases of people coming to the department and saying, hey, I got vaccinated and I got COVID-19, I thought I was protected. And often it is because they didn't wait for their full 2 weeks to time out before going out and doing some of the things that the CDC says you can do when you're fully vaccinated. So one thing you should know, breaking as of this morning, however, is the CDC and the FDA have put a pause on administration of the Johnson & Johnson vaccine because there were 6 cases nationwide out of several million administrations of Johnson & Johnson of a rare blood clot, and they want to investigate the relationship between the blood clot and the vaccine. The Advisory Committee on Immunization Practices will be meeting tomorrow to discuss whether there's any connection. And out of an abundance of caution at the department, we are also, or at the state, we are also having vaccine providers pause their administrations of the Johnson & Johnson vaccine. So we will keep everybody looped in as we get more information. Right now, we're just trying to make sure that we are being as cautious as possible and following the guidance of our federal partners. So just know that that will be the case for at least this week. Last thing to know is many of you may already have gotten vaccinated and experienced this. I experienced this last week. You may have temporary reactions like a sore arm, a headache, feeling tired or achy for a day or two. I had a fever after I got my vaccine. And our epidemiologists like to say that that means that your immune system, that it's working and your immune system is gearing up to be able to fight the actual virus. Kicking it over to you, Dr. Vann.
Sure. Thank you so much, Hattie. And I am one of those people that today is experiencing a little bit of tiredness and soreness. Yesterday, I got my second dose of Moderna. So I anticipate that this is not going to last for too much longer, but I'm here right now. I'm talking to you guys, so everything is okay. I wanted to just mention one other thing to the previous slide that Hattie talked about, that we're really not, when we're talking about the effectiveness of the 3 vaccines, we're really not comparing apples to apples. The 3 products are very different. Moderna and Pfizer have completely different methods of production compared to the Johnson & Johnson. They have also been included the clinical trials in differently geographic areas of different groups of people. So taking that into consideration, I think is really important. We have a tendency now to really look at these numbers and try to compare them head to head. But in this particular situation, that is not necessarily the case. The Moderna and Pfizer are mRNA vaccines. The Johnson & Johnson or the Janssen vaccine is a different type of vaccine with a different strategy for helping our immune system. So they're just a little bit different than comparing them, like I said, head to head. So moving on to the second question that we received that is addressed on the next slide. If you don't mind advancing the slide, I think that would be super helpful. Thank you. So what are some of the updates on the mask mandate and anything that we see on the horizon? At this time, we don't have any indication on when the mask mandate will be lifted or modified. We anticipate that this is going to be one of the last mandates that would be lifted or changed in the executive orders from the governor, since wearing the mask is one of the most important prevention methods that we have and can significantly decrease the rate of transmission in our community. We know and we anticipate that this is going to pretty much happen towards the last stages of the executive order decreasing some of those mandates that we have for our community. So continue to keep an eye out for that, but for the next couple of months, we don't anticipate for the mask mandate to be modified. Moving on to the next part of the conversation, we did see a lot of questions around quarantine, isolation requirements, and then also requirements after vaccination. And these can be a little bit confusing. So I try to summarize them in the next slides, and then we're also going to be more than happy to share these slides so you can go back and reference them. I'm probably not going to go word for word on these slides, but I did include as much information here just as a reference point to you. So a little bit of an update. I know that you probably are aware of this, but just to get back to the basics of what is quarantine and what is isolation. So quarantine is the practice of keeping people that have been exposed away from others in order to try to prevent the spread of disease. So these are individuals that have been exposed, but there is no indication that they are COVID-19 positive. So when can you stop the quarantine? With the new CDC guidance and the change in the policy that is going to come from Guilford County Health Department in the next couple of days also, is that after 10 days of quarantining, after you are exposed, if you don't develop any symptoms, then you can exit quarantine and continue the activities that you would normally participate in. If you have the opportunity and you choose to also receive a test 5 days after the exposure or 2 days before the 7 days time frame. So if you go and you get a test and that test is negative, you can also exit quarantine after 7 days. So this is a slightly different approach than the typical 14 days that we have been using in Guilford County. We've had several areas of concern that made us choose to continue with the 14 days as far as our metrics looked pretty bad at the beginning of the year. We were concerned about the spring break and the rise in number of cases after those activities. And we also wanted to see more people getting vaccinated before we change our protocol. But all of those are moving in the right direction right now. So as of Monday of next week, we will be implementing the new recommendations for quarantine. So again, 10 days after exposure without testing, or 7 days after exposure if a negative test result is done and there are no symptoms. When we move to the next slide, we're going to see a little bit of the difference in the isolation requirements. So isolation will be implemented for anybody that has a COVID-19 positive test result. So these are people that have the infection. So we have 3 different categories here. Somebody that has or knows or thinks that they have COVID and they have symptoms. They have to stay in isolation for at least 10 days since the symptoms first started, at least 24 hours with no fever, and without fever reducing medication within those at the end of those 10 days, and other symptoms of COVID-19 are improving. They don't have to necessarily go away altogether because we know that some of them may linger a little bit longer after the 10 days, such as the loss of taste and smell. Also feeling a little tired can also persist a little bit longer than the 10 days, but we know that that person will not be infectious anymore after that time frame. If somebody tested positive for COVID, but they do not have any symptoms, if they continue to not have any symptoms, then they can be with others after 10 days have passed since the time that they have had a positive test result. So this is fairly simple. Hopefully, no symptoms will develop during that time frame, and they can resume their normal activities after the 10 days. If they have COVID-19 and they tested positive, but they also have something that is making their immune system weakened, if they have some type of immune disease or something that is affecting their immune system, they're immunocompromised, they're taking some type of cancer treatment or medication, some type of health condition, this would be kind of a case-by-case situation, and they may have to isolate for longer than 10 days, depending on that unique circumstance. So that is taken into consideration at the time of the case investigation. Moving forward and talking about getting tested after COVID-19, we do recommend that testing does not happen within the first 3 months or more after completing that isolation period, because that test can continue to be positive for that time frame, and retesting should only be done if you develop new symptoms of possible COVID-19. And then the last part in this type of group of topics is really around the protocols after being vaccinated. So on the next slide, we'll talk about what does it mean to be fully vaccinated. So people are considered fully vaccinated 2 weeks after their second dose in a second dose series, such as Pfizer or Moderna, or 2 weeks after a single dose vaccine, such as the Johnson & Johnson vaccine. If you do not meet these requirements, you are not considered fully vaccinated, and you will not be able to take advantage of the new requirements after being fully vaccinated that we're going to talk about in just a second on the next slide, what you can and can't do if you have been fully vaccinated. So there's a lot of information on the CDC's website around what you can and what you shouldn't do. What you can do after being fully vaccinated is that you can visit inside a home or private setting without a mask with others that are fully vaccinated. You can also visit people without a mask that are not fully, and that group of people or that household is not vaccinated if they're not at risk for severe illness. So if they're younger and they might not have any type of underlying health conditions, wearing a mask is not necessarily required at that time. But if you are visiting family members that are not vaccinated and maybe are 65 and older, they have underlying health conditions that can put them at high risk for severe illness, we recommend that mask continues to be worn. Also, traveling domestically without a pre or post travel test, traveling domestically without quarantining after travel, and some other traveling let's say permissions if you're fully vaccinated. But the one part that I put in big, bold green letters is that you don't have to quarantine or get tested following a known exposure after you're fully vaccinated and if you remain asymptomatic. So those 14 days, 10 days, or 7 days of quarantine are not needed anymore. They're not required anymore if you have been fully vaccinated. So that's a huge thing for a lot of people to be able to not stay in quarantine. And that's one of the huge benefits of being vaccinated. I believe that we have maybe one more slide. Hattie, nope, this is addressing the questions that were posed ahead of the conversation, and then I'll come back and talk to you about some local vaccination efforts after Hattie talks about some of the North Carolina DHHS initiatives. Thank you.
Great. Thanks, Dr. Vann. So I'll just go right into our updates. This should be pretty quick. I think the last time I spoke to you, I spoke for maybe 15 or 20 minutes. This should be a lot quicker than that. My main goal here is to kind of tell you where we are on vaccination, where we hope to be, and then spend a few minutes talking about tools that we have specifically for the employer community. So we were, remain on track to be at least 50% of North Carolinians getting at least one dose of a vaccine this week, which is great. We are very proud of our local providers and, of course, individuals making the decision to get vaccinated to get us to this point. We are hoping, we are expecting about 7 in 10 North Carolinians will want to get vaccinated, although our goal is for every North Carolinian to get vaccinated. We think that the low-hanging fruit will be another 20%, but getting from this current group of folks to that 70% that we think are the most interested is really going to be tough, in particular because I think a lot of folks for whom it is harder to get a vaccination because they're busy, especially your employees, they're working during the day when a lot of vaccine appointments are, and they aren't able to find the time to make time for 2 appointments. They might be worried about side effects and taking time off work. That's really what's preventing them from getting a shot, even though they are themselves interested in getting a shot. So, one of our goals for the upcoming couple of weeks is to really go above and beyond to engage workers. I think you all might remember that we spent about a week in group 3, which is when frontline essential workers were eligible for vaccinations, and then moved pretty quickly onto group 4, in part because we saw providers had trouble filling appointments when frontline essential workers had their turn. And I think it's for the aforementioned reasons. And now that we have a lot more supply, and now that we've opened up to everyone, we really want to go back and make sure that no stone was left unturned and that nobody falls through the cracks. So with that goal in mind, let's talk a little bit about tools that we have for employers. So you all have likely been having conversations with your employees about vaccination. You may even have sent along many of our resources to your employees to get vaccinated. I'll go through some of those resources in a minute. We would love for you to offer to facilitate vaccination with your workers if that makes sense for you. There are, for smaller employers where there's maybe only 1 or 2 employees totally, or even a dozen employees, of course it makes sense to maybe just direct them to their local provider and go sign up for an appointment. But for larger employers, there may be opportunities for on-site vaccination or for a partnership with a local vaccine provider to have kind of a vaccine event dedicated to your industry or to your workers specifically. And then the last thing is we really have seen that the difference between a work site taking up vaccinations and deciding to mostly get vaccinated and not is often those nudges, those psychological nudges to remind people that it's a priority. And there have been lots of interesting things that employers have been doing to nudge their employees in that direction. And I'll get into that a little bit on the next slides. So the first thing is just we have a ton of communications resources for workers. They're geared at essential workers, but of course not everybody is eligible. So these are broadly applicable to everyone. We have a template email for employers to send to their employees or for employer associations to send to their members. And the template email includes, the 5 key things you need to know about the vaccines, plus how to sign up for a vaccine. We have employer guidance specifically for you that includes templates of things to send to your employees. It includes posters and flyers, what to know about vaccination, key PSAs, things like that. And then we have videos on directed that are featuring frontline essential workers specifically, although it's just generally them talking about why they want to get their shot. So, item number 1, help us get the word out. We've really seen, I'll give you an example, a lot of hesitancy, or not hesitancy, but low take up among manufacturing workers for a variety of reasons. But we've seen that the manufacturing plants that have done that pre-work of sending out regular notifications about vaccinations and sending out information have much higher rates of take up than those that don't do that. So if you are in a category of employer where you have only a few employees and you just want to navigate them in the right direction, and so it doesn't make sense for you to necessarily reach out and partner with a provider, but you still want to steer them in the right direction, you can direct them to our website, yourspotyourshot.nc.gov, to get reliable and accurate information. They can call the COVID-19 Vaccine Help Center if they're not as comfortable using the internet or don't have broadband. And the COVID-19 Vaccine Help Center has all of the information that's on that website. And then if they decide they're ready to go and get a vaccine, they can go to the Find My Spot tool, which is on our website, type in their zip code or their address, their city, and find all their local vaccine providers. So that's sort of the lowest touch way to get vaccinated. Then there are some higher touch ways to get vaccinated. And I know Dr. Vann actually has much more specific information on who to partner with if you're looking for a partnership in Guilford County. So I'll mostly leave this to her. One thing I want to pull out of this chart is the opportunity to work with occupational health to get vaccinated. So there's definitely opportunities for you to partner with a local provider and potentially either get on-site vaccination or do a local vaccination event targeted at your industry or workers. But there's an even shorter path to getting vaccines if you have a contracted occupational health services provider. So if you have as much as a nurse on site who has vaccination in her scope of practice, or all the way up to a contract with, an Optum or a Concentra or something like that, you can have them sign up with us to get onboarded and enrolled in our vaccine management system. And then they just have to request doses through our sign up form, and they can get the doses delivered directly to your site and then get your employees vaccinated. So that's an option for you. I would recommend, please reach out to me and we'll get you onboarded and enrolled as quickly as possible, because that's always that is definitely the path of least resistance. This is another program that we've stood up. And again, Dr. Vann will have actually even more specific resources for you. But we happen to be fortunate enough at the department to have the Economic Development Partnership of North Carolina serving as liaisons to employers if you have questions about vaccination or are looking to get your employees vaccinated. So if you are interested, if you're unable to kind of form a partnership with a local provider and you're interested in joining a wait list for doses from providers around you, you can work through your employer liaisons at that link to find a provider who works for you. So lots of options for you. That's probably a good segue to, I'm going to stop sharing to Dr. Vann to tell you the even more hyper local context for how to get your workers vaccinated.
Sure. Thank you, Hattie. So you can see that in the chat because I thought that it would be a good resource for all of you. I have copy and pasted the link on the North Carolina DHHS website that gives you all of the information that you would need in order to become a provider, not necessarily you as an agency, but just like Hattie mentioned, if you do have occupational health, this would be really a very fast and effective way to get your team vaccinated, receive medications or vaccinations yourself. Some of the products that can be transferred to you that is not Pfizer can be kept in refrigeration units, so you don't need to have huge ultra cold chain units. Some of them have lower packaging number, so you can just get like 100 doses of the vaccine. You don't need to necessarily get 1,000 of them. So there's a lot of step-by-step information on how to become providers. There are a variety of employers in Guilford County that have already went through this process, that have already received allocation as business owners. So this would be just a good opportunity to maybe talk to each other and see how that process has been going, and if this is something that you guys can help each other out through that peer-to-peer partnership. When we had a conversation a while ago, there were very limited providers in the community that could offer the vaccine, and things have drastically changed since then. We continue to be a main vaccine provider in Guilford County in partnership with our healthcare systems, but we're not the only ones anymore. We have been extremely fortunate to have the FEMA site active in Guilford County that has vaccinated over 100,000 individuals just in the few weeks that they have been here. We have a variety of commercial pharmacies that are also active, CVS, Walgreens, and Harris Teeter. Harris Teeter is adding 2 to 3 sites almost every week. So check with local Harris Teeter, CVS, or Walgreens pharmacies. They also offer the vaccine. And it's very encouraging to also see local pharmacies or family-owned pharmacies that are also signing up to be providers. There are at least 6 or 7 of them spread around the county that have also been allocated vaccine doses. And then again, large employers can become vaccination sites for their own campuses. And it's really not a complicated process. And that step by step can probably be approved and move forward within just a few days, to be honest. So a lot of opportunities here in the county. I've also mentioned last time that I've talked to you all that we're looking in ways to partner with you to help bring the vaccine to your campuses, not necessarily through the health department per se, because we continue to operate the 3 large mass vaccination sites, and it becomes a little bit challenging to have the bandwidth to move into additional campuses. But we have very good relationships with vendors that could come on your campus and do vaccination clinics. One of them is StarMed, and some of you have already worked with StarMed to provide vaccines to your team members. We have been working with them since March, April of last year, first around testing, now around vaccines. So we have a very strong relationship with them. We know their work ethics and their values are very similar to ours. So we feel very comfortable creating these connections between you and StarMed to come out. We also know that there are other providers in the community that you may have been contacted by or are reaching out to you to provide these clinics. As we learn more about other providers, please share that with us, and we'll be more than happy to look into it to find out if there are valid providers. I might not know about each one of them because there is a growing list constantly, which is a really good thing, but I cannot necessarily vouch for each one of them. But I will be more than happy with our team, and Meredith has done this also, to try to look into it to just make sure that all of those providers are approved by the state, that they are reputable sources of vaccines, and we have been able to identify at least one more for our community that could come out and do these vaccine clinics. I think that it's important to listen to your team members and share with them the information that we're sharing with them. There is a lot of very good marketing and educational materials on the North Carolina DHHS website. And after I finish talking, I'll be more than happy to also add that link here to address some of the concerns that your team members may have. We know that there is a spectrum out there between vaccine hesitancy to vaccine curiosity and anything in between. And I think that it's important to identify that these concerns that our community has are valid, and we need to listen to them and give them the respect to address these concerns that they have in a positive manner without making them feel they are targeted, or that that they're disrespected by their views and attitudes towards COVID-19 vaccine, because I don't think that there will be a way in which we will be able to get to the bottom of those concerns unless we listen to those concerns and try to address them in an efficient manner. So continue to be mindful of that as you're having these conversations with your team members, since everybody wants to be heard and everybody wants to be able to express those thoughts or feelings about it, and we have ways to address them. So if there's any specific topic that you find it difficult to address, or if there's any topic that you don't really know exactly how to respond to from your team members, any questions that are coming out from your team, please feel free to reach out to me. I'm sure that Deborah and Meredith will connect us, and I can provide you with all of the resources that you need in order for you to be empowered to address those concerns with your team members. With that being said, I'm going to go ahead and turn it over to Meredith, I believe, to move us through the agenda for today.
Perfect. Thank you so much, Dr. Vann, as always, and Hattie. You two stay on the phone, because we'll be dialing you soon, I'm sure, or sending you more questions or asking for more updates. So that was wonderful, and we appreciate it so much. I would like to welcome Shawn Straub, President of HR, excuse me, and to share with us what we'd like to know is, I know there's several questions about bringing people back to work and what that looks like, and if there are any guidance that you have on those employees as they transition back into the workforce. I know many are already there, but we'd love to hear from you. Thank you so much for being here.
Thank you so much for having me. I'm just going to share my screen. Okay, that should be it. So I did want to talk, starting with the basics about the COVID vaccine, not the actual medicine part of the COVID vaccine, but COVID vaccine and coming back to work. And the very first thing that I often hear from employers is, can I mandate my employees to get the COVID vaccine? And the very short answer is yes, you absolutely can do that. The EEOC, which is the Equal Employment Opportunity Commission, came out and said private employers can mandate their employees to get the vaccine. However, of course, there is a caveat to all of this. And the caveat is, when you are thinking about mandating the COVID vaccine and when you're telling your employees this, you need to make some concessions, and you still need to comply with the Americans with Disabilities Act and with Title VII. And what that means is, if you have 15 or more employees working for you, then you are covered under the Americans with Disabilities Act, and you're covered under Title VII. Americans with Disabilities Act basically says that if someone has a medical reason why they cannot receive the vaccine, you need to make an accommodation for them. And Title VII is about accommodations under for religious reasons. So if someone says based on their religion they can't get the vaccine, then you also need to make an accommodation. And what that accommodation looks like can be really different depending on the type of employer that you are. And when we go down that path, does it mean that they take a leave of absence? Does it mean that they have a separate office? Does it mean that they get to work from home? But when you're thinking about that, the thing that you really need to think about is, should I be making the vaccine mandatory for my work environment? And there are three things that you really want to think about. You want to think about, is this a reasonable request for your company? So do you have a company where everyone's really just like sort of in separate offices and you're not seeing the public? Is that really reasonable that you need to have the vaccine? Or do you have a company where you're interacting with the public and it would be a great idea for everyone to be vaccinated? I know at Alt HR Partners, we're all very proud that we are 100% vaccinated, and it's something that we make sure that we tell our clients. We have 30 clients throughout the triad, and we want to make sure that they feel comfortable when we're coming into their offices. If you are making the vaccine mandatory, are you making the accommodations that you need to make? And then finally, if you do have policies in place, are they causing some kind of disparate impact with the rest of your workforce? So when we think about a disparate impact, that means that the policy may seem rational, like, yeah, everybody needs to be vaccinated, but it's actually negatively impacting an entire group of individuals. And one of the things that we want to think about with that is if we're providing incentives for employees to get the vaccine. And at this point, about 80% of employers that were surveyed in a national survey by the Society of Human Resources said that they were providing some type of incentive for their employees to become vaccinated. And my slides were a little bit out of order, so I'm going to go back to this one, where I also want to point out that only about 10% of employers are saying that the COVID vaccine is going to be mandatory for people to come back to work. And again, this was a national survey. We did our own survey just of our group here in the triad, and we had only 8% of employers saying that it was going to be mandatory for employees to come back, and 70% really on the other side saying absolutely not, they're never going to make this mandatory. So for the people who are really encouraging the COVID vaccine and offering something for their employees, you have everything from offering PTO of 2 to 4 hours. You have some employers that are offering money to their employees, lift reimbursement to go get the vaccine, and store credit and rewards. So a lot of the local grocery stores or national grocery stores chains are offering especially that time off. So Aldi, Kroger, Lidl, they're all offering time off to their employees so that way they can go and get the vaccine. You're also seeing places like Amtrak and Chobani and Dollar General offering up to 4 hours of time, 2 hours per vaccine for their employees. One of the meat packing companies is offering a $100 bonus for their employees. Lidl is actually offering a $200 bonus for their employees to get vaccinated. And these are great things. And I, as someone who's fully vaccinated, I encourage all my employees to be vaccinated, my family to be vaccinated. I'm 100% vaccine. I also am 100% of reducing our overall risk as employers. And when we say we're going to give you $200 if you go get vaccinated, it could be creating that disparate impact that I was talking about, in that if I have a medical condition and I can't be vaccinated, then I can't get that $200. So if you're going to create policies like this, it's really important that you think about how can I also compensate the people who, they really can't be vaccinated. And some companies like Kroger, which is giving out $100 for if you can prove that you were vaccinated. What they're also doing is if you take an educational course on COVID, on how to stop the spread of COVID, you also get that $100. So that way everybody has the opportunity to participate. So when you're thinking about your policies and thinking about how to incentivize people, you want to make sure that you're including everybody in that discussion. And so when what I really want to talk about is the risk. And this is really a question that I get a lot, is what is my liability if someone gets sick from COVID or if someone gets sick from the vaccine? And there is no definitive answer on this. And the reason why is because we're just starting to see what that liability might look like. So this is a graph from Jackson Lewis, which is an attorney here on the East Coast. They're a really large attorney. And they have been tracking the number of lawsuits that have been coming in COVID related. And this week it hit 2,000. And so they've been keeping track of why are people suing their employers and what are they being sued for and what does that lawsuit look like. So when a law is written, we have what the law is, but the way that we interpret that law is through lawsuits that are settled. So one of the things that we can learn from all of this is that the lawsuits are coming in now, and it's going to take a little while before we get the results from them, but we can still learn a lot from them. So I pulled up the North Carolina lawsuits. There are currently 5 lawsuits in North Carolina of employees suing their employers because they got sick at work. And the number one reason why is 3 of those lawsuits are about leave accommodations, meaning someone got sick and they were not allowed time off to recover from that illness, or they lost their job because they were ill. One of them is about retaliation. So someone complained about unsafe work environment and then they were terminated. And one is a class action lawsuit in one of our school systems about workplace safety. And so what we can learn from that is it's not that people are suing because they got sick. It's because they're suing because they feel like they weren't treated fairly and they feel like they weren't protected. So what can you do to protect your company? The number one thing is that you need to document everything that you're doing. You need to create and distribute policies. So if you want people to be vaccinated, you're going to need to create a policy about it and make sure that everyone understands it. If you want to make sure that everyone is wearing a mask while they're in community areas in your workplace, you need to create a policy and distribute it. And then you need to communicate with your employees. And this is really similar to what Dr. Vann was saying. You don't want to just talk at people. You want to listen to what they're saying, and you want to have a two-way conversation with them, whatever that is about. Don't just make assumptions that they don't want to get the vaccine for whatever reason. Maybe they need an accommodation. Maybe they need some encouragement. Maybe they need some some documentation to help them understand the vaccine or some resources. And maybe you can provide that if you're having that conversation with them as opposed to speaking at them. And then you really want to make sure that you follow all your policies and procedures equally across the company. This is the number one way that employers really got into trouble, is when you're not applying your policies and procedures to every single person the same way. And you're making exceptions or you're looking the other way. So it's really important that when you have those policies and procedures that you're following them equally. And then what we're definitely seeing across the whole country is that when employers get in trouble, it's when they're ignoring published guidelines from their state, from the CDC, from the World Health Organization. So if they're saying, we don't care about masks in our location, we don't care about protective equipment, you don't have to do any of that, that's when employees feel like they're at risk. So as long as you're following all those published guidelines and you're doing your best to protect your employees, the chance of you actually having risk or liability is really, really slim. Okay, that's the end of my presentation. So I'm going to turn it back over if there are any questions.
I know there'll be some follow-up questions, Shawn. Thank you so much. That was good information, and I know that gets a lot of people thinking. Please let us know if you have questions on that note. I do have a couple here that came in through the chat from Holly. On the on-site clinic, and please jump in, Dr. Vann or Hattie or Shawn, if you have this answers, but how do you set up with StarMed? Is that just a quick website link if you want to do an on-site with StarMed?
So the way that I have done it before is that I've received emails from some of you saying that I have a number of employees that want the vaccine. Can you help me with this? So then what I do is just I take that exact email and I send the connection to the representative from StarMed, making a very short virtual introduction, and then I let the StarMed representative and the business representative take it from there to decide exactly what's going to be the best course of action, times, days, 2 consecutive days, or whatever the case may be. The only let's say requirement that StarMed has is that you have 100 or more team members that will be getting the vaccine during that time frame, so they can come out and get vaccinated. So shoot me an email and I'll make that connection with StarMed. I'll be more than happy to do that.
Thank you. Is 100 basically that magic number that for on-site clinics? We had another question about employee totals or employee counts for those on-site clinics.
Well, one of the things to keep in mind is that that's how we can transport vaccines sometimes. And we're very mindful of the way that the vaccine needs to be transported and the way that the vaccine is distributed. And then also, there's a lot of cost. I mean, you guys are all business people here, there's a lot of cost that is involved in these clinics and the team members that are making it happen. So sometimes it's really cost restrictive to be able to come out and put all of the resources for less than 100. But if that is the case, then we can work with you guys and try to schedule those team members to come through the clinics that are already existent. So we'll make it work. We'll find a way to make that work.
Great, thank you. I do know several folks on the call who I see, I know have had clinics on site or are planning to do on-site clinics. I also spoke this morning with an on-site nurse at the Procter & Gamble Swing Road facility who is more than happy to talk with anyone about their on-site clinic experience, how they administered those vaccines, how that process worked, and is happy to speak with you one-on-one. So if you'd like to speak with Jill Simons, please let me know. And I'm sure some of other companies will be happy to talk with anyone who's interested in an on-site visit to share their experience. A couple more questions on the, not on the on-site clinic topic, but for example, if an employee receives a vaccine first or second and calls into work with some symptoms, how does the company determine if it is a side effect of the vaccine, which will maybe last a day or hopefully just a day, or if it could be COVID? How should they stay home? Should you stay in touch with the employee? What's the safe bet on the symptoms of a recently vaccinated person?
Yeah, so I think that Shawn would be great to kind of chime in here too, but I think that first of all, anybody who's sick and is not feeling well should stay home, and everybody should feel empowered to be able to stay home if they're not feeling well, regardless of the fact that this would be a COVID-19 exposure or infection or the response to the vaccine. So that's just kind of like, let's just put that out there. As far as how do you make that determination, I think that it's fair to say that if the person feels unwell a day or two after the vaccine, that's pretty much what it is. If they continue to feel unwell after that, then we would recommend that they stay home and they go and they get tested and follow through that process to identify if they're positive or not, because it is a very high probability or a probability that they may have been exposed to COVID-19 right before they went and got their vaccine, and now they're seeing the symptoms of the vaccine. But I think that overall, allowing everybody who doesn't feel well to stay home and make them feel like that is okay for them to take care of themselves is going to be important. And that time frame, just like me, I got the vaccine yesterday. I'm fairly sure that my symptoms right now are related to my second dose that I got yesterday. But Shawn, any other thoughts on that as far as a legal perspective?
Yeah, thank you, Dr. Vann. I completely agree with you. And I think what we've heard from the government since the very beginning of this pandemic is to please allow employees who aren't feeling well to stay home without giving them too much trouble, without asking for doctor's notes, without, let's just give people grace and allow them that opportunity to feel better. And as Dr. Vann said, I'll share my personal vaccine story. I was sick for a full week. I had 2 days where I just was completely out of it. And I'm still not feeling well. And it's been 2 weeks now. So just giving people grace and having that conversation with them. And I know that it's really frustrating. It's really frustrating for everybody. Those people don't want to be out of work. They want to be back at work. And so, just giving them that time to be able to heal.
Thank you. Great. I have a couple facilities here, well, several with multi-locations in Guilford County and surrounding counties. Basically, some of these companies have been keeping their employees in their own home-based facility when normally they could travel between facilities. So once someone is vaccinated, they're just looking for some guidance. Should that person be allowed to travel? Is it safe for them to move between facilities? Is there any guidance on or advice on multi-facility, communication and folks moving between as they do their jobs?
So,
Sure. So I think, go ahead, Hattie, please.
no, go ahead. I think we're probably going to speak to the same piece of guidance.
Yeah, so I was just going to refer back to the vaccination guidance, which really gives people a lot of movement and a lot of mobility after they are considered fully vaccinated. So absolutely, yes, if you have team members that are fully vaccinated, so 2 weeks out from their last second dose or their 1 dose product, I don't see any concerns for them to be able to be mobile between the different sites. Hattie, anything else that you're going to add?
Nope, not at all. I would just say, especially the CDC grants broad latitude to interactions between vaccinated people, which just adds to the urgency of getting all your workers vaccinated.
Is there any liability to an employer to bring in a provider to vaccinate employees, or any guidance on that? Maybe that's Shawn.
You say that one more time. I wasn't sure.
Yeah, any liability to the employer to bring in a provider, an outside provider to vaccinate employees, or any guidance on that process? I guess maybe talking with an employer who's been through the process might be the best.
Yeah, my only advice on that, and I certainly don't know the exact answer, is to ensure that you're getting all the proper sign-offs from everybody, whether that be the vaccination information or declination information, to make sure that you just have documentation on everything that occurred.
Okay, this is one that I remember being a big topic of one of our very first calls in 2020. Is there any guidance on temperature checking right now? I remember that was a huge topic of question or concern earlier on, but I know the schools are stopping that process in the next couple of weeks. But what do you recommend for our facilities? Or is there any recommendation?
Yeah, so I'll say similarly, it has always been part of recommended but not required guidance that for any kind of public facing sort of high traffic areas, that you be doing things like putting in place the vapor barriers, and you do symptom screening and things like that. And that remains in our guidance. But for example, the office where I work has shifted from having a person there to be taking people's temperatures to doing daily self-symptom screening. And there's a little sign at the door where you pause and you do self-symptom screening. So remains a best practice, but not required. And as you can see, even in our facilities, as more people get vaccinated, we're phasing it out. I don't know if Dr. Vann has anything to add from her perspective.
No, that's exactly right. I think that it's important to mention the fact that we still say that this is best practice. If this is extremely challenging for you and it's requiring a lot of resources to be put in place, shifting to that self check-in, let's say, is definitely an option. We have in county buildings, we have these thermal cameras that are being utilized for temperature as well. So we utilize the apps to reply to our questions, and we can do that in the car before we even get into the building. So I think that there are a variety of ways that can be done, but that is not a requirement.
Thank you so much. Deborah, did you want to wrap us up? I appreciate everyone being here. It was great to see your names and some faces. So I'll let Deborah wrap us up, and we will talk soon.
All right, Meredith, thank you so much for facilitating this portion of our call today. And again, we want to thank Hattie and Dr. Vann and Shawn for being our experts today and providing valuable information, ongoing information about the vaccines and the vaccination process. Please know that we are going to send a post-call communication that will include the recording, as well as resource links and the slide decks. And let's all continue to do what we can to encourage everyone to get a vaccine and continue being safe. I am confident that we will probably have a third vaccine action call at some point. when it's appropriate, but we appreciate our experts being willing to answer questions and be with us today. So thank you all so much. All right, hope everybody has a great afternoon. Thank you.
Talk to you soon.